Hey, thank you for joining the coaches locker room. We got people are waiting already. We're coming in. Guys, when you come in, we got a great show for you tonight. We're going to actually go behind the scenes and show you exactly how the MD Live app works, how the Health Alliance Network can really help a lot of you that are out there still having questions and wondering, is this app for real? Folks, it's called telemedicine. And what we want to do tonight is walk you through, give you a walkthrough on what that's about. So as you come in, if you can hit the share button, that would be great. I have my guests there in the green room waiting. So hopefully you guys, all my dads out there, hopefully you guys had a great Father's Day weekend. But again, we're excited to have you on. And again, if you have questions, tonight is the night to ask, because we're gonna pull the curtains back and we're gonna share with you exactly how this process works. So it's right now it's 7:01, so we'll give you guys a couple minutes, and then I'm gonna bring the guests in, and we're gonna go jump right in, and we're gonna Steve and Joey, and he has his other partner Jim here. We're gonna actually talk to you guys about anything you need to know about the actual healthcare platform and how that works. So we got Tawana Lewis. Hey, Paula. Hey, Fiona. Hey, Jennifer. Thank you guys for joining. Please hit the share button as you come in, because again, most of you that have questions, this is the time to ask those questions about specialists, any other questions you might have. It's important that you ask those so you can have a level of comfort for what you're actually investing in. Is probably the best investment that I would say that's available out there when it comes to folks that don't have any kind of coverage. You do want that. So without further ado, I'm going to bring my guests into the locker room here. Hey, Dominique, how are you? We got the everything working live. Okay, thank you. I appreciate it. Make sure you type your questions in. We got a lot of folks that are still working. It's been a long weekend, so we're going to bring Joey and Steve in. They're going to be in 3, 2, 1. There's Joe and Steve. Guys, say hi to Joe and Steve. Guys, say hi to the coaches locker room. So we got like I said, I'm excited because there's just been so many different things happening this weekend or last week since last Monday. Folks that have signed up and that have seen savings, and those that are asking questions. It's just been really, really good to be able to share that information with you all. Then Steve and Joe, you guys there?
Yeah, we're here.
Hello. Okay, you guys. Hey, Denise, how are you? Thank you for joining. Steve and Joe, you guys say hello to Denise. She was one of the first sign-ups. She signed her mom up, and we got a pretty good story with her mother. Thank you for joining, Denise. We appreciate it. And we're going to cover all the questions. So those of you that have signed up, this is a great opportunity to see exactly how the back end works. These guys are going to share with you every step, what you need to do to access the system, how to pick your doctors, set the appointments. Guys, you're going to go through the prescription part too. I'm going to be your trigger guide behind. And then a lot of folks are asking about the medications with the Good RX. The savings that you can get from that. And then I know with Denise's mom, I shared with her before she signed up, she was the one whose mom had the heart medication and saw the huge reduction. So thank you for coming on, Denise. And then Joe, Steve, do you guys want to introduce your partner as I bring him to the stage?
I believe Jim is on the line live from.
He's in the green room. I'm doing the drum roll so you guys can bring him on the stage. There's the drum roll.
Where? He's not, I don't have a drum roll. That's the best I got. You can bring him in if he's there.
He's right here. 3, 2, 1. All right, there's Jim. Thank you, Jim. Thank you for joining us here in the coach's locker room. You guys say hi to Jim. Welcome, Jim, to the coach's locker room. And so, guys, let's go ahead and just let's kind of recap from what happened last week. But before we do that, Jim, why don't you introduce yourself to our audience? Tell them who you are, what role you play with the company, and what value you think this telemedicine Health Alliance Network can do for someone out there with no coverage.
Oh, that part's easy. My name's Jim. I'm the Chief Operations Officer at Health Alliance Network, and tons of examples and stories and scenarios on how this has helped people. When you're out, especially in the summertime right now, people traveling, going out and about right now. I was just talking to some people in Kentucky about that this earlier today. And allergies or whatever it may be, when you're out there traveling, to be able to have a physician, access to a physician, wherever you are, whatever you may be dealing with, even if it's something that you're not sure if it's a medical emergency or not. I mean, again, if someone's choking, you call 911. But if you're in a scenario to where, I don't know if this is an emergency or not, and you need access to a licensed medical physician in that area, you can have that with a $0 copay, $0 consultation fee anywhere that you're traveling inside the United States, especially in this vacation season.
Great. Steve, Joe, what do you guys have to share from last week? It's been amazing. I've had a chance to talk to a lot of people. What can we do to get everybody more excited and basically take advantage of this? I think it's a once-in-a-lifetime opportunity, especially for something that's where it doesn't really compare to anything out there. What can you guys share with them tonight tell them what they can look forward to tonight, looking behind the scenes at this platform?
Couple of things that I like to share, playing off of what Jim had just said, Coach. Something that happened to me after our meeting last week. My oldest daughter and grandson were traveling from their home in Kentucky to see some friends in Virginia for the weekend. They got there on Friday night. Everything was fine. When they got up Saturday morning, my grandson had a terrible earache, so the entire day was going to be ruined. She had three choices. Do nothing, go to an urgent care, or go to the emergency room. Urgent care doesn't accept insurance. She has insurance, but her copay would have been around $600. So she calls me, and I said, don't forget we have telemedicine on your phone. So she immediately used the telemedicine app. She got a diagnosis of earache, which we knew what it was. And my grandson got amoxicillin and took some Tylenol, and he was on his way to feeling better the same day. So the entire weekend was not ruined. Had she not had her telemedicine app, you don't have a doctor with you when you're traveling from state to state, particularly this time of year. People are going on vacation, they're moving around, they're visiting friends and relatives and going to theme parks. The last thing you want to happen is for your vacation to get ruined because somebody comes up with a sudden illness. That's a prime example of what we did. A little bit later in the event tonight, in the show tonight, I want to show you an actual demonstration of a real live call. And my wife's probably going to kill me because I'm going to just show you what it looks like on a phone when she's sitting in the background, and she just gave me the eye. You're not going to do that, are you? We'll show you what a real live call looks like. We're gonna hold out some of the information, obviously, because it was a real live call to MD Live on a telephone. So we'll talk about that later. Joe?
Okay. And I do have the MD Live, the sample app up, so you guys can walk through that, and then, like you said, to do the call. So I think for most folks, it would be really helpful if they can kind of see kind of a visual presentation and kind of see the big picture in terms of how this works. And I think it would also, once they do sign up and get the coverage that they need, that they'll have a better understanding of how this works. And then, team, also, you can always go back to this live here and watch this demonstration. So you're going to have a recorded demonstration to see exactly how it works. So it's important that you guys ask questions. If you have questions, go ahead and ask questions so we can put this on video and it'll be recorded and you can go back and watch it as many times as you want. Okay? Right. So what we're going to do is let me bring in, I'm going to, okay, let me do.
It's perfect, right?
Can you guys see that?
Yes.
Okay. Wow. Okay, great. This works out pretty good. I thought maybe, let me see here if I can, How's that?
Can you make it a little bigger, Coach, or no?
That's what I'm working on. Let's see here. Can you guys still see that?
Steve can.
Okay.
His eyesight's a little better.
Okay. All right. So we'll do this. So what we'll do is Steve, Joe, you guys walk me through here as far as what you want me to do, and then I'll just pull all the buttons in the background here.
So I'm going to let Steve do most of the talking just because of the actual seeing of it.
I'll get it. Right now, the coach has a screen pulled up that says, see a family physician in Florida. So let's do that because your app automatically knows where you're located. It just wants to confirm that it's accurate, that you're actually in Florida. So let's go to the next step there.
Okay. Come here, see first available.
Well, you're logged in. Why don't we not see first available? Let's go to choose a physician first, because if you click on first available, I'm going to show you what happens in just a moment.
Okay. So
bottom right, Coach.
Huh?
Bottom right. Schedule
right under the big blue button. It should
schedule a visit. Right?
Yeah, okay. Right. Schedule a visit. Okay.
You can also click family physician and choose therapist, psychiatrist, or dermatologist from that window as well.
Right. Okay. Gotcha. Okay. So we're good.
So from there, you can see a list of physicians that you could choose from in your local area the next time that physician would be available to speak. So let's just click on one of the physicians. Just click on the picture because you get to see an image of the physician. Just pick one.
Okay.
It gives you the education, the background, the languages that doctor speaks, and where he practices, and if he has any specialties. You can also search for specialties with the search feature, like you need a special, maybe a pediatrician or a gynecologist or an ear, nose, and throat specialist. You can also search for that in the search bar. So right now, if we select that doctor will come online, live on your phone or live on your computer or tablet, and you will have a two-way conversation with that doctor about whatever your issue is, your ailment is at this time. So you can close that window out.
Okay.
Well, you could see before you do, Coach. Okay. Well, you saw it. I'm sure everybody could see it clear. You could schedule the times. The times were listed right next to the. Yeah. You can see just above. Steve, what color? Greenish.
Right. Yep. Yep. Right here.
Yep. So you can pick a time that you want to actually schedule a visit and scroll to additional times as well.
Okay.
Now I'm going to show you a real demonstration. Now that you've seen that, I believe 2 weekends ago, my wife was not feeling well. She had a sore throat. So she decided to use telemedicine. It took 12 seconds to get a doctor online. She chose first available. And the phone call lasted about 12 minutes. I'm not going to show you the entire 12 minutes. I just want to, if we can see the screen, let me know if you can see this first, Coach. Can we see that?
Yes.
Okay, good. I'm going to put this up. She's looking at her phone. She's going to select first available. First available. Now what that is now is the doctor, or it's waiting for the doctor to come on. We timed it, and it was 12 until the doctor come on. I was standing behind her filming, and there's the doctor.
Wow. Okay.
I don't want to put the audio on for the conversation because it was a private conversation, but the doctor came on in 12 seconds. That diagnosis lasted about 12 minutes, which is a lot longer than you get when you go to see a doctor face to face. But about 12 minutes with Dr. Adams, he gave her a diagnosis, and that was the end of the story. But that's how easy it is. Just used her phone to talk to a doctor.
Okay, great.
And get treated and released.
Yes, treated and released. Yes, absolutely.
Back into the comfort of her own couch as she was.
Okay, great. All right, so do you guys still want to continue to go through this platform here? If we went back to this menu here, and I think Jim mentioned that, and this is the way I normally use it. I would go on the side and see if it's medical or behavioral or dermatology. can you guys walk through the ones that, I'm thinking more common questions that folks would have when they're browsing through the MD Live and they say, okay, what is this? What is this? Because some people actually be a little bit quicker. And Dominique gave us a really nice comment here. Now, Joe, you guys, Dominique does life insurance. Her and her husband, Sean, they do a good job. So this may be a good way for them to bundle this with their life insurance. She's the one that actually coached me and got me trained to get my life insurance certificate. So her and her husband are great, great people. But she says she's a mom of 3. Can you guys see the comment?
Yes.
Yeah. So that's a nice feature.
Way too much time at the doctor's office.
Yeah.
She's not alone.
Yes. So let's jump in and go to the actual. What's the best way to navigate if someone is specifically looking for something and they're not having to, say if they don't schedule a visit, but they want to actually see what's going on, how to use the app. If there's an emergency and they need to navigate quickly, what do you guys say about using the left side if someone needs to go to the pharmacy or they saw the doctor and they need to check their medication and see if they're getting a better rate before they actually head out?
Jim, can you walk the coach and the audience through that screen that's up right now?
Yeah, so if you actually click on, you see how the word's underlined where it says family physician and the state Florida, you can actually click on that family physician and it's going to give you a drop down right there. And you can choose between a therapist, psychiatrist, and dermatology, and of course, family physician is already selected. Breaking it down into those 4 basic groups, generally speaking, most often it would probably be family physician is what people are going to want to select. If they have a small child, it's going to, depending on their age, when they have a dependent and they click on your name on it and you can add a dependent. If there's a small child, it's going to default specifically to a pediatrician. So when you have a small child on there, there's really no other choice. You're gonna if you're doing family physician, you're gonna get, if it's a small child, pediatrician is the default, and then you're gonna be able to speak with a specialist, basically with just the children. But that's going to be the basics of where you're going to want to be. You're going to want to make sure that you're in the state of your current location, because if a prescription is deemed necessary and appropriate, they need to be able to find a pharmacy that's close to you so you can have access to that medication as needed. And you can always choose first available if you'd like. As an example, my wife, her first language is not English. So whenever she yells at me or she's in panic mode, she goes to Spanish. And so what she does is she goes to schedule a visit, which is on just below that blue box, and you can actually filter by language. And so if you over on the left-hand side on the next screen, you would be able to filter by language. So you could say, you know what, I want a list of physicians that speak Spanish. So below the blue button, if you were to click right there, correct. And then you can, now over on the left, 3rd from the bottom is language, 2nd from the bottom is gender. So if you say, you know what, I really want to make sure I speak to a male doctor, I really want to speak with a female doctor, you can sort that and, or language or whatever, and you can see a list of the doctors, filter the doctors that are available according to your specifications, and then you could schedule a visit directly with them.
Okay, so let's do this. So if we did a demo right here, if we're using just the sidebar here, so If we say someone needs to see a dermatologist, okay, there's a rash, a kid broke out from, say, a soccer camp, they got this really bad rash on their skin. So would they click dermatologist?
They could. They can also use family physician. Dermatology is more like, hey, listen, I have this growth on my arm. Can you look at the size, the shape, the color, and tell me if you think that it's something that I need to be concerned about or not?
Okay, so we'll do that.
If there's a rash, we can go into that. But also family physician can look at that as well.
Okay. So we would do family physician, Jim, and then available. So.
And then say language. If you want, you could sort by language. What I generally, when I show people this, I usually go down to Spanish.
Okay, let's do that.
The language. And then I just pick an individual. Typically, when you're going to schedule out, like right now, the time East Coast is 7:20. So you'll see that people are going to be available around 8:30. So they typically, when you're scheduling a visit, because remember, these are non-emergency visits, scheduling a visit, it's going to default to about an hour out from right now. And what happens is if you're going to choose, first available, you're going to wait just minutes as opposed to waiting, an hour. So the first available is a lot more speedier than choosing scheduling a visit.
Okay, so here's a question. So we got a family physician. So if someone is saying available, so if it's something physically that they can show the doctor, as opposed to having to walk in, so that would it be wise or prudent to select video?
Yeah, you can. And depending on the state of where the individuals are located, a video call would be required before anything. And then follow-ups could be done telephonically. But yeah, typically, you may not want to go, oh my goodness, I'm laying in bed. I don't want to do a video with a doctor. But I always go with video. Especially with my kids. Sometimes we spoke about a rash. My child had a rash, my middle daughter, and I took pictures of her torso where she had the rash, and I was able to upload those, and those stay on a HIPAA-compliant server linked to my daughter's profile, which is separate from my profile.
Okay, great. So under this, let's kind of go through, because I got more people that are joining in, watching. So if we're going down this list, Jim, we've picked a family physician. We're available by video, and we'll just play this out as a scenario. So in this particular situation, so under the specialty, let's just create a scenario so the viewers can kind of get an idea of what options are available to them.
Okay. You want to do specialty or language? I like language just because it kind of demonstrates how the diversity of it.
Okay, so we got Spanish in there. Do we need to do anything for gender?
You can if you want. You can just it's once you make the selection, you'll see that it kind of spins, and then if you change gender to say male, you'll see the change. You don't have to click save or anything like that. It already changes. So if you go to female, so I have, I'm doing it along with you just so I can see it a larger screen. So what I have is provider type, family physician, language Spanish, gender female. Because creating a scenario.
Okay.
I'm a woman and I think I have a UTI and I speak Spanish. I want to be able to speak with a female physician about this in my native language of Spanish.
Nice.
So I can go here. I'm going to select. If you want, you can pick one. If you want to go ahead and pick a physician from the list.
I'll just pick the first one here.
Okay.
And it says she's available at 8:30, 8:45, 9. Okay.
All right. So we could click on say 8:30. So we're going to go all the way through this, and then it'll say, "Would you like this appointment by video or phone?" We can go ahead and do video. And go ahead and click continue.
Okay.
Now you could say the reason for the appointment that pops up. You could say, as an example, you could say sore throat, or you could just type in the letters UTI as that's the example of what we're going with. So UTI of frequent urination or UTI symptoms of pain with urination. Let's go with pain. It doesn't really matter right now. We can upload an image. If we want, we can put any additional comments or concerns and just go ahead and click continue. I'm leaving those blank. I'm not going to upload a photo.
Gotcha.
just go ahead. Now you'll see that it's going through to check any health conditions, any medications I'm currently taking, allergies, surgeries. It's already selected as no because this is a test account.
Right.
You do whatever applies to you. If something is yes, you're on medications, please put that in.
Okay.
Go ahead and hit next or continue. It's just going to verify a pharmacy. The one that's on here is down in Miami, Florida. We can keep that, or we could change the pharmacy to something local.
Okay.
I'm just going to go ahead and hit continue.
Okay.
Now you'll see here the confirmation. What you're going to know, you may or may not notice, is it skips number 6, step number 6. I don't know if you see, because we're at number 7 with confirmation.
Yes.
The reason it skips number 6 is because there is no copay. There is no consultation fee. So
yeah, we love that.
There's no one's asking for a credit card information. Nothing. It's here. You're going to go here. Now be careful here, Coach, because I don't want to tie up a physician, but we can be very careful here. It says if MD Live was not available, where would you have gone? And you can choose, emergency room, urgent care, whatever it may be. Do you have a primary care physician? Go ahead and click yes. And here's why I want you to click yes.
Primary care physician?
Okay, yeah, let me, so you can click if MD Live, go ahead and answer that if you would have gone to urgent care and then see there in the center, do you have a primary care physician?
Yes.
Go ahead and click yes.
Okay.
Now you're going to get a pop-up. The reason for the pop-up, the power of the pop-up, the reason for the pop-up is they can share this consultation with your primary care physician so that way they're kept in the loop.
Oh, nice.
That's a pretty huge thing because you don't have, I have this going on over here and I have that going on over there. No, this is all, it can all be connected if you want it to be. And if you want it to be, go ahead and you input your primary care physician information. You can read and check those 2 boxes, enter your initials, and then don't do it for the purposes of this. Do not create the appointment because that'll tie up the physician at that moment.
Right.
But we click create appointment, and that will lock you in.
So you want me to get out of this page right here?
Yeah, you can back out of that.
Okay. And then I would basically check those 2 boxes and then put my initials in there, correct?
Yes, sir. And then go ahead and you could scroll down and to where you see the green. Yep. Create appointment.
Okay.
That would be that.
Wow.
Now here's what happens. If you're doing it on an app on your phone, then there's something running in the background and you're going to get a pop-up as to when notifying you that the physician is ready to see you. That the physician is online, click this button to be connected. If you're in an area and the Wi-Fi, the internet is kind of spotty, and your internet's not working, you will receive a telephone call saying, hey, I see that you had an appointment. You weren't able to do it. Would you like me to connect you with a physician right now?
Wow.
And then you have the choice. Do you want to do video or do you want to do telephone? And then do whatever's most useful to you in that moment.
Wow, that's amazing. Jim, that was great. That was really great. What did you guys think? Hey, Jason, how's it going, Coach? Thank you for joining. This is good stuff, man. This is really good stuff. How many of you all enjoyed that presentation? If you enjoyed that, type A in the box because I'm telling you, this is a game changer. And I'm telling you, I mean, the more I learn about the power of this platform, it's just absolutely amazing that you can receive care without having to leave your house, and you can be seen and you can be treated. You guys, I'm asking you guys just on behalf of some of the other folks here, let's say, okay, now that we've gone through that part of it and the doctor says, okay,
it's 7:30.
What type of medication you're on? Let's use, for example, I'll use myself. Let's say if I'm diabetic metformin and say my prescription is $60 every time I need to refill is $60 after certain refills. How could you guys do a presentation for those that do have meds and maybe their meds are too high because their deductible is too high and they're thinking, hey, if I can save a few pennies through here, could you guys do a demonstration through GoodRx and say kind of price comparison so folks can see the added value beyond the $35 a month?
Let me give an intro to that, Coach, if you don't mind. We have a real life example that occurred this week. We have entered into an agreement with GoodRx as our pharmacy benefit administrator. And what that entitles our members to is extremely deep discounts on prescription medications. Even pet medications are included. If you need a prescription for a pet, you can run it through our system and find out where's the lowest price available nearby.
For a pet?
We had for pets too, right? We had a real life incident this week. Two of them, as a matter of fact. I believe you can talk about one of those. Let me talk about another one. One of our customers, one of our members, wanted Lunesta and had no insurance. So the prescription when they logged in was, I believe, and Jim, was it $381?
$385.
$385 was the cost of the prescription. The prescription then, when we ran it through our program, went from, I'll just cut to the chase, went from $385 to $16.01.
No way.
With no insurance, cash price, $16. I believe that was at Publix, I believe was the lowest price.
Wow. Ooh.
But when you go into the system, it gives you several options. It doesn't just say you have to buy at Walgreens or Publix or CVS or anywhere. It gives you an entire list of available locations and the price at that location. The way you use it is you just log on, you get the price, and then when you call your prescription in, you just tell them that you are a GoodRx member, and it's on your phone or your application. You'll see the member number up there. It's the one that's associated with Health Alliance Network. And then when you go to pick it up, you just show them your phone, or if you want to print a coupon out, you can print the coupon out and then show it to the pharmacist, and you immediately receive that discount.
Wow.
I heard a story this week about you, Coach. One of your members had used the service this week, I believe, or last week, was it?
Yes.
Why don't you share that story with us? I was amazed at that story because they have been suffering for a long time overpaying for a prescription.
Right. That's in here is Denise. She's a good friend of mine, and I spoke to her about the actual program, and the bus comes and picks her mom up from where they live to go get treatment, to go see a doctor. And as it turned out, the medication that she was paying a lot of money for was really, really expensive. And I said, give me the name of the medicine. She gave me the name of the medicine. I think, and Denise, correct me if I'm wrong if you're here, but I think it was about $700 or $720 for that heart medication for her mom. And I put it in, typed in the medication, and it came back that same medication was available for $360.
Wow.
And I'm like, wow. And she said, Coach, sign me up. I'm signing up because, we talked about this before. It's like when you see the value and I'm thinking, when you think about $35 a month for 12 months, that's still probably a lot less than what most people's copay is, for the whole year. And you can take advantage of all these services and not have to ever worry about it. She typed it in. She said it was $720. So, it just cut right in half, and this stuff is real. And like I told you guys, if my grandmother had the same issues, bad heart, high blood pressure, diabetes, high cholesterol, you name it, and she went on to be with the Lord, but a lot of her ailments was because there was no access to this. And, at that time, Medicaid it was just starting to grow. This was been years and years ago. I was in college, so it's been over 30 years ago that this happened. But just think of how far we've come with advanced technology and what it does for a lot of people. But it's things like that. And I know there's someone here that's listening tonight that maybe or have a similar situation, have a loved one or know someone that don't have any coverage. But we're talking about $35 a month. But you guys, let me ask you a question, and any one of you can take this question. Some people say, well, what happens if I have Medicaid or Medicare? You know, how can this benefit me? Because I got a lot of questions about that, and I didn't feel comfortable answering that. So I said, let's wait until Monday, and I will ask the question for you. But what if someone does have Medicare, Medicaid? Does this work for someone that have that service available to them?
Yep. Sure. So this is not a, it's not an insurance plan, what we have. So it doesn't bleed over into any part of any other healthcare coverage that you may have. Medicare, Medicaid has nothing to do with us, and they have and vice versa. We have nothing to do with them. Same thing like with your insurance. So if somebody has any type of insurance, which may, and my deductible is ridiculously high, may, you'll never get into those points where the insurance company is going to be paying or anything of that nature. Now, one area that I have noticed lately, I'm getting feedback, and I even happened to me once with my daughter, I do have prescription coverage on my insurance plan. However, that is also part of the deductible. So it was going to cost me more for my daughter's prescription if I went through insurance, because it was part of my deductible, so I still have to pay, as opposed to going through our prescription benefit plan, which I took well advantage. It was a 70. I did the exact math, 76% less cost if I just used my own benefit instead of even going through my insurance.
So let me see if I understand what you just said.
Yeah.
You're paying a monthly premium for your insurance.
True.
And in order to get a prescription, it would cost you more to use your insurance than it would to use our plan.
4 times more. True.
Perfect.
So that's really how it is. You know, I often say we really are a standalone healthcare provider, and that's pretty much what we are. We're very, very unique, but we deliver the best product. To have our doctors available to all of our members 24 hours a day, 7 days a week, and our doctors work on Christmas morning. So if somebody wakes up on Christmas morning and is thinking they're going to have a bad Christmas, will have to wait 3 days before they could even call into a doctor's office, that problem doesn't exist anymore.
Wow. Hey guys, it looks like we got another one of your buddies in the green room. We have Steve Sellers hanging out in the green room.
Oh, a special guest appearance, Coach.
Special guest appearance.
His screen is black right now. I'm waiting to see if he comes back in before we bring him on as the next guest. Guys, I really appreciate this, and I'm getting text messages. That's why I keep looking down. Feedback. Hey, Steve, what's up, my man? We're gonna bring you in. So we got Mr. Steve Sellers in the house. Y'all give Steve a hand. Thank you for joining
us. Hey, everybody. Nobody could be happy with this picture right now.
Steve, why don't you go ahead and introduce yourself to our viewers and tell them who you are, what role you play in this incredible company and the product that you guys have put together to really help a lot of folks out there, that are hurting and can't seem to get what they need to stay healthy.
Coach, thank you for putting on the call and letting us be on the call tonight. And yeah, my name is Steve Sellers. I'm the CEO of Health Alliance Network. And I enjoyed listening to everybody else, Steve and Joe and Jim. Always a lot of good information you could get from those folks on the call. One thing I want to say about what we're doing here at Health Alliance Network, what you're hearing about is telemedicine. It's not the future of medicine and healthcare. It's what's happening right at this moment. And what we're doing, I'm not sure if it was mentioned on a previous call, but we're a full service healthcare company. besides doing the telemedicine, we do Medicare, we do Medicaid, we do home health. So we are all things healthcare. Telemedicine is an absolute natural extension of everything we're doing in healthcare. And we are on a mission of always searching for the next ability to provide greater service to all of our customers, new customers, existing customers, and providing what is available in the market today with the best pricing and the best service. And I think absolutely with this product, as you're seeing, and Jim, you gave a great demo, I think you can see the absolute value of this. I think everybody on the call also had an opportunity to express a scenario where they had either a convenience story or an emergency story or just a service story of something that was able to happen in a time frame where we have the ability to take control of our healthcare. And we've never had that ability before to have full control over our healthcare experience. Technology is allowing us to do that now. And we're taking advantage of it. This is just the beginning. This isn't the end of a new service. We're just scratching the surface. There's a lot more coming down the pipe for absolutely everybody's healthcare needs. So we're excited to see what this industry is bringing forward and what we're able to do and have an impact on the industry as well.
Hey, Steve, let me ask you a question because I had someone ask me this over the weekend. They asked, is the Health Alliance Network, is this just a standalone product, or is this kind of a microcosm of what you guys have done in the healthcare industry, that you guys actually have been in the healthcare field or own a healthcare company? Can you kind of go through that? And because most people are like, is this just kind of a fad? Is this just something that just came up? Is there a background to support this platform? Kind of more of a credibility thing. I had to ask because I got a lot of text messages about it over the weekend and say, hey, have these guys really been in the healthcare field? Have they owned a company? Can you kind of elaborate on that a little bit?
Yeah, no, absolutely. We have been in or are in 27 states around the nation in our home healthcare business. We have a Medicare business we've had for many years. We have a Medicaid business. We are also currently expanding our Medicare business in different locations in Florida as well. Telemedicine is a natural extension of everything we're doing to really bring a greater amount of service to our existing customer base. And by bringing it to our existing customer base, it only makes sense for the public in general, because we all have these same needs of having accessibility to doctors, having a cost structure that's affordable. As you mentioned, the price for the service itself is less than most people have in their deductible. I know it's less than my deductible. Whenever I bring one of my children to the pediatrician, it's $50 a head. And I got two, and it's never one head at a time. It's always two. So in our situation, and Steve laughs at me, but it's about once a month my kids are going to the doctor. That's just how we roll when they're 6 and 7 years old.
Yeah.
But it ends up being a huge cost saving. So we have a long experience in healthcare as a whole. We also are tied to health insurance. We sell insurance. We have a financial background. So we've done products and services to people besides healthcare and insurances and finance. So we've been full service for a very long time. This is an absolute natural extension of everything else that we are offering. So, we're a company that's been around for a long time, although this leg of our product suites, it's fairly new this year. Last year we started, but we come in with the longevity of good business, a good sound business foundation of everything else that we have done, everything else that we are a part of, and all the other components that we're putting together for this healthcare platform. There's a lot more to come. The telemedicine that you're seeing now is the first, the prescriptions is the second, and then we have more products and services coming down the pipe as well. So you're going to see a large expansion. Okay,
great. Outstanding. Guys, what I'm going to do is I was able to pull up the video that I want to show to everyone about how telemedicine is helping doctors diagnose, treat allergies. So, Jim, I'm going to put you in the green room here for a second while we run this video.
Viewers will thank you.
Stay on with us. Hang out. I feel like Don Lemon on CNN, so I'm just kind of moving people in and out of the green room here.
Be careful. You know what happens to Don Lemon every New Year's Eve.
That's right. So what I'm going to do is let me run this here.
Our job is to sell socks.
I'm going to switch it here in a second.
That's why we love
rounds treating seasonal allergies through virtual doctor visits. Allergies are the 6th leading cause of chronic illness in the U.S. Did you know that? They affect 16 million American adults and more than 5 million children. Dr. Tara Narula shows us how doctors are delivering help so patients don't even have to leave home. I know for most people, they don't like to go to the doctor, so I'm thinking this is a good thing.
It's good for you, Gail, for sure.
Most people are needing it. Thank you, Tara.
We diagnosed that quickly.
Yes.
With spring allergies in full bloom, the wait to see a specialist in person can be several weeks, but scheduling a same-day visit through telemedicine is virtually a click away. An explosion of tree pollen this spring is setting off Dylan Kirsch's allergies.
Hi, Dr. Ram.
Hi.
Instead of taking him for an office visit, Dylan's mother Lisa sits with him at the kitchen table for a virtual visit with pediatrician Sylvia Rahm.
What's been going on for the last couple of days?
I've been coughing and I've been sniffling. A lot of congestion.
You get something called allergic shiners, which means that you get dark circles under your eyes.
Open your eyes. Okay.
You can have the parent pull down the eyelid.
Can you see them?
Okay. There's a particular type of symptom in the throat called cobblestoning, and that's the postnasal drip that comes from allergies. Tip your head up, Dylan.
And then face him a little bit more towards the camera.
Okay, so it doesn't look terrible to me right now.
So he's been taking allergy medicine for 2 days. Today was your follow-up. How did the follow-up visit go?
The follow-up visit was great. It was wonderful because I didn't have to pull him out of school and make an appointment in the middle of the day, take a day off from work to do this. Kids actually love video visits because they know the doctor can't give them any shots. So that
over the last 5 years, allergist Tanya Elliott has made about 7,000 remote house calls, finding clues she wouldn't see in her office.
It's about having carpets, having drapes, curtains, decorative pillows, upholstered furniture. So those are the things that we discuss when we talk about the first line of treatment, which is allergen avoidance.
A recent study led by Dr. Elliott identified potential benefits, including faster diagnosis and medication prescribing, lower out-of-pocket costs, and access for people in remote areas.
Do you feel like it got any better at all?
Researchers also found face-to-face screen time might improve the doctor-patient relationship.
It's all about building rapport and active listening and facial expressions that then establish that connection with the patient.
One of the things that you could try
before adding another medication then is the air filter. And then we can check back in on that.
Great. Thank you, Dr. Ram.
Take care.
Bye. You say bye, Dylan?
The telehealth industry is expected to grow to $36 billion by 2020. Right now, 34 states and Washington, D.C. require insurance companies to cover virtual visits, the same as they do for office visits. But of course, services like shots still have to take place in person.
Unfortunately.
Boo.
Boo.
Boo just for shots in general, regardless of where they take place.
Boo for shots in general, but I know that they're very important, so I get it.
Sarah, thank you.
Thank you.
All right. Great presentation. You guys want to follow up on that and just kind of touch on just the value of that? I think that's huge when you're talking about the wave, what's coming, being ahead of a trend. And we talked about this last week. We got about 10 minutes left. Guys, if you have questions, just type them in the comment box. Again, like I said, we want you to have all your questions answered. I know a lot of you are going to text and email me anyway, but be brave, ask your questions with Steve, Joe, Jim, and the other Steve to make sure that you have a good feel for what's going on. So if you, there's one other demonstration, guys, that I'd like for you guys to do. Someone texted me and asked, could they see a demo of what the GoodRx looks like searching for prescriptions, looking for different price comparisons, because it seems to be a big concern. One lady says she's being gouged with her medications, and does GoodRx, just price comparisons. So could we do one of those? If I put the screen back up, that we can do walk through the GoodRx.
We can do it by the screen, or we can do it on my phone. You can do it by app, or you can do it by computer.
Okay, I have it.
If you have it up, do it there.
Yep, I have it right here.
Perfect.
And I'll just move it to a solo here. So let's see. Let's get out of here.
Coach, while you're queuing that up, I just want to comment on that last video so your viewers have a little understanding about how that video just ended. I don't want them to be misled by what they heard at the end. If you listen very closely, that they say that 36 states have basically mandated that telemedicine be part of their insurance. In that, generally, that's what it said. So what that means is that if they went to some type of outside company and had a telemedicine visit, and it was, let's say, a $70 telemedicine visit, that has to be processed through that insurance claim, just like as if you were going to a regular doctor. That's what that meant. So it's not like, oh, the insurance company's covering you on telemedicine in some states. They're not. That's the same thing as part of your insurance plan. If you have a deductible and you have a telemedicine visit, great, thanks for using the platform. That's going to be part of your deductible and or copay, and you still will pay that $70 visit. So I didn't want the listeners to be misunderstanding about how that CVS special ended.
Okay, great. Sounds good. So let's, so here we go here. Who wants to take us on a journey through, now that the person's been seen by the doctor, and now they wrote them a prescription for, let's just pick one. Denise, if you're still on there, could you type in the name of the medication that your mom used, so we can use that as a demo, so we can show the audience, if you're still on. If you can type the name of the medication in the box. So we'll give her a couple of minutes. I think she's still on, but we'll give her a couple of minutes. And but I found the GoodRx, the pharmacy, I found some great deals. I was just going through, putting in my medication, putting in other folks' medications, and just looking at the savings. And Steve, I think you did mention that they don't have to have the GoodRx card, that they can print out.
That's correct. They don't need the card. All they need to do is show the result in the search engine. They can print it if they want, or they can show it on their phone. They can either print it or show it on their phone, either way, to the pharmacist. That's all they have to do.
Okay, great. Okay. So while she's probably trying to get it from her mom, but what I'll do is I'll switch over to the actual platform here. You guys can walk us through, and then once she pops up, I'll give you guys the medication. I'll type it in, and then we can kind of show what type of savings are out there with these prescriptions through different pharmacies.
Here's my app. If you can see that, Coach, I'm not sure that you can. Can you see that?
Yeah.
Yeah, I'm going to select amoxicillin because it's easy, and I'm going to select amoxicillin from the drop-down menu. Sorry about that. Find the lowest price is what I'm saying. I just push the blue button, find the lowest price. It looks like the lowest price right now nearest me is Walmart, $4 for a complete prescription of amoxicillin.
You said $4?
$4.
Wow.
Right, exactly.
What's the normal cost of something like that?
I can tell you, typically the highest price on here is $18 through our app, $18. But amoxicillin is $5 or $40, but we can buy it for $4. But we have a little secret about that here in South Florida. And I think Joe might want to talk about the secret that we have about amoxicillin. We have an amoxicillin secret that everybody needs to know about.
All right. Sounds good to me.
You got to tell them.
So Publix does have a list of free medications through their pharmacy as a community service. Amoxicillin happens to be one of the free medications at Publix. So you have your choice of getting it free at Publix, or if for some reason it's a convenience thing and you're going to Walmart anyway and you don't want to have to go to another pharmacy, you see it's available for $4. Publix also has a list of 4 other additional specific antibiotics that are free. Amoxicillin, penicillin, SMZ, 2 others. So Publix really does a great service for us as a community, as a whole, and offers a number of free medications. And if those of you that weren't aware of that, they also have some other lists. Coach and I are aware of the diabetes medications. They have some that are free also. Blood pressure medicine is also available at Publix, free of charge to their customers.
Yes. Hang on. I'm pulling up the GoodRx.
Now people can see it.
Another really good one is the EpiPen, which was controversial the last, being in allergy season right now, bee stings, all of that stuff. If somebody that has allergies, EpiPens, everybody's looking for EpiPens. And they had raised the price, the drug manufacturer, to a cash price of $600. And that's a good one to look up on GoodRx as well, because that has $147.94.
EpiPen?
Yeah. EpiPen. And that's for 2 auto injectors plus a tester. So, you can practice, you just want to get, it's go time and you get shy. So.
Yeah, wow. So you said the EpiPen, what's the normal price of it?
The manufacturer had released, I believe last year, they'd raised it to $600. I see right now a cash price. If you go into some place, it's $376. But with us, let me see what screen you're on. If you get the coupon off to the right at, say, Walgreens, I have $147.94. Now, if you want to click the get free coupon, you can pull that up. That's going to give you a couple of numbers on that green box. Yeah, that's going to give you a couple of numbers, and those are the numbers. That's where you find the numbers. When your pharmacy is going to ask you for either what's called a PCN number, a BIN number, a group number, or a member ID.
Wow.
Over there, those 4 numbers off to the right. Those are any combination of those numbers the pharmacist is going to ask for to put it into the system, and that's when you see the deep discounts.
Guys, the nice thing I saw about this was that you got 3 options. You can print it out, email it, or you can text it to your phone.
Yeah.
I saw that somewhere where a young lady showed it on her phone to the pharmacy technician, and were they able to scan it? I think scan the numbers or just take the numbers off of it.
Yep. Yeah,
wow.
They just type it in. Yep.
Wow.
And it's applied right then and there. What was the one, Steve, we just talked about? $16.01. Lunesta. Yeah, that's a really, that's like a 95% savings, and it's amazing. Yeah, here it is. Yeah, Lunesta. And you just type it in, and when you see, just like as one of your friends had experienced, when you see something that's for hundreds of dollars get cut in half, or something that in this case is was it $385 cash price?
Wow.
And it gets cut down to $16.01. It's just huge savings.
Yeah. Yeah, that's unbelievable.
I can tell you a real life story. I have a really bad allergy that I've suffered for many years with, and I needed an EpiPen, but I refused to buy it at $600. I just wouldn't do it. So Jim, our partner, says, why don't we just check our program for an EpiPen? I said, I'm not even going to pay $300 for an EpiPen. I just can't do it. He said, well, just let me check. So he checks for me, actually. He did everything. And it ended up being, I believe, $147 for 2 EpiPens. Now, there's many people out there, many families that can't afford to fulfill a prescription for an EpiPen. And their children need them, either them or their children. But with our program for $147 for a 2-pack of injectable EpiPens, that's a hot topic, and it's a very popular medication right now.
Yeah, absolutely. Wow. I'll tell you, we have one question here from Jason. I'm going to put it in here. He said, do you guys cover surgeries? Anyone want to take that on?
I'll be happy to address that. Do we cover surgeries? The answer is no. It's difficult to do surgery through a telephone. We don't have that technology yet, but we're working on it.
I got you. Okay. Well, I think what we're going to do is, if you guys want to sum up, I'm going to type in, for any of you that have watched this and you're interested in getting this plan, can you guys just kind of do a final recap just for how simple this process is, what you get for it? Because we have other people here that wasn't on here last Monday. What do they get for $35? And then also, guys, I wanted you guys to touch on, there's a lot of business owners in this locker room as well. And what the benefit, if I'm an employer and I want to offer this coverage to my employees, what does that look like? So can you guys go through the personal side, and then for someone that owns a business, that someone that may work in a restaurant, they may be part-time and they're not working enough hours to get full medical coverage. Can you guys kind of draw out a scenario for those individuals?
Hey, Jimmy, we're going to throw that one to you. You want to take that one?
Yeah, if you want, I can do that. And I'm also going to go over the why as well, because that's pretty, that's a really good question, why? And one of the reasons why, well, first let me go over your question. What are the benefits, especially with a business? Employees don't have to take off half a day to go sit in a waiting room, go schedule an appointment. Hey, I got to go. My doctor's office ain't open at nighttime. They'll only open during the daytime. I need to go take off work and go get visits done sitting at the doctor's office. There's no need for that. So with on the employer side, having employees that are able to stay at work, be able to do a consultation, because it's not an emergency situation. They're sick, earache, headache, flu, fever, allergies, whatever it is. They can quickly connect with a physician on their lunch break and pick up the prescription either then or on their way home. One of the other things is too that also is when you're talking about Medicare, Medicaid, and everything. Remember, you're doing this at home. This is in the comfort of your home. If you have small kids like I do, so if you hear noise any second now, they're going to come busting through the door. But if you have small kids, they can stay at home, resting, recovering, getting healthier without having to be drugged to an urgent care center, to sitting in a waiting room around other sick people, infected people, and everything like that are contagious. The kids can just come in and you can go do the visits, and then you can go pick up the prescriptions and start the kids on the medication right then and there, And the other thing is why. We've been talking a lot about telemedicine as a whole, but why telemedicine with Health Alliance Network? $0 copay, $0 consultation fee, $35 to be a member of the Health Alliance Network, and that's it. No other hidden fees. I was speaking to a woman that was working at a university, and her husband works at a hospital, and he has telemedicine, but only for him, not for the family, and he has a $45 copay. So whenever for what's the benefit? The benefit is $0 consultation fee, $0 copay, and it's for you and all of your dependents. So every other scenario that we've come across, everybody else that we've experienced that has telemedicine has copays, and if it's done through an employer, it's only for the employee. It's not for the employee's family, the employee's household, the employee's children. All of that is encompassed in this for something very affordable at $35 a month.
Great job, Tim. Joey, you and Steve want to close out. How does it work with an employer that wants to offer this? Say if you have part-timers, how does that work for someone that owns a business?
Great question, Coach. So here's what I've found in the last several months especially. Employers want to give some type of health care benefit to their employees. And traditional insurance has just hindered that ability for most employers. It's just too darn expensive. So when I sit with an employer, the very first thing out of their mouth is, I have been wanting to give my employees some type of healthcare benefit. And then when I go through the product and show them how it works, I'm at basically 100% success rate in creating a healthcare plan for their employees. It's very special to give an employee a benefit. When you can give an employee a benefit that is to the employee and then spreads into their home, because many of us are married with children, that is unmatched. And like Jimmy had said earlier, the zero copay, zero deductible, to encompass that whole product platform, 24-hour-a-day access to doctors. We have a dermatology service. We have 3 hours of behavioral health included in the plan, and it covers you and your entire household. There are no contracts. There are no cancellation fees, nothing of that nature if you decide not to have the product anymore. It truly is unmatched, Coach. We are clearly the leader in this space. We want to give our members the most healthcare products and services available. And employers are ecstatic when we tell them what their fees and rates are under an employee package, which only requires a minimum of 3 employee signups. And if there are any employers listening that are considering something like this, we are very proud to have streamlined that process for the employer. What do I mean by that? We did not make it paper crazy, things that they have to provide. They don't have to provide us with the employee's driver's licenses, social security numbers. Things of that nature are not required. It's a very simple process: name, address, phone number, gender, email. It's very, very simple and basic. And we do all the work for them. All they do is provide the basic information of their employees, all their names and that little bit of information. And then we take the ball and run with it there, and we will contact the employee through email with the sign-up instructions for them. So we've made it very simple for the employer, and they've all had a great response to our process, Coach.
Right, outstanding. And then also, as far as someone asked, is there a contract? How long does the service last? Is it month to month? Can you guys expand on that?
Sure, I'll take that one, Steve.
Well, that's easy. We are so positive that each and every one of our customers will keep our product. We don't offer them a contract whatsoever. We have 2 options. You can go month to month if you want at $35 a month, or you could buy 3 months in advance. You can cancel anytime. There's no cancellation fees. There are no additional fees whatsoever. There's month to month, no cancellation fees, no copays, no deductibles, nothing more out of pocket for your entire household. It doesn't get any better than that.
And there's a slight savings, Coach, if somebody does want to do a 3-month pay. It's $99. You save a little bit, but a lot of people find that as a convenience as well. Hey, I don't have to worry about this for 3 months. I just pay it 4 times a year instead of 12 times a year. Just a personal preference, but there's a little bit of a discount there also, Coach.
Correct. So here's the next question. If someone wanted to just try it out, do you guys recommend, do you all recommend that they do the $99 plan for 3 months in case you have someone that says, hey, before I really jump in, I want to try it out and see how this whole process works? How do you address the issues for someone that's kind of lukewarm, but they're saying, I do like it. It seems like a really great deal, but before I jump in with both feet, is there anything I can take advantage of? Could I take advantage of the $99 deal for 3 months to see if this works for me and my family?
I'll take that one because I have a specific view on the $99 with that kind of scenario. I would kind of, it seems like you're leaning that way, Coach. I would 100% lean towards a $99 3-month coverage. Because how awful would it be if you did the $35 and then all of a sudden a month you're like, I didn't get sick. Let me cancel that. And then a couple of days later, oh my God, why did I cancel that? Now you're sick. So 3 months is definitely a good time to give that a shot, especially if it's a household, because the chances are, if you're like me and married and have 3 children, there's always somebody getting sick within a 3-month period, if not more often, Coach. So I would say the $99 3-month is definitely highly recommended by me.
Wow. Okay. What was the other question here? I'm looking here because they're typing in texting me, and I'm let's see here. What was the other one? Oh, what's the limit for the family for the $35 a month plan? Someone says I have a big family. How many people can I have under this $35 a month plan?
Everyone in their immediate family that lives at that address is covered. It also covers children away at college or traveling. So there's no limit to it. Okay,
that was the next question. The one lady that signed up earlier today that you helped out, Joe, her question, she was saying, she needed it for her son because he's going off to college. She's on Medicaid, but she was really wanting it more for him. What do you say to that? I thought that was interesting. What do you all say to parents that want to get coverage for their kids? Because, when they go off to college, if they leave Florida, like some of us did, and go to cold weather states to go to college, and when winter blows through, they're getting colds, and then they got to study for exams, or if they're athletes. I've had a lot of parents whose kids are athletes going off to college in the fall and then, out of state. What do you say to parents who have kids that are away from home, the value of this, if they get sick in their dorm room or run down studying for exams? Because, in dorm rooms, your freshman year, there's probably all types of germs flying everywhere, in there. What do you say to a parent to give them a comfort level to say, how can this help my kid when he's off to college, or her?
Well, instead of trying to figure out what to do when your son or daughter calls you at 11 o'clock at night because they're not feeling well and they have an exam the next morning and you're in Florida, and say your child is in Texas or Arkansas or Alaska, it doesn't really make any difference. Instead of trying to figure out what you're going to do and scramble to find a doctor at midnight, the only thing that they have to do is pick up their phone and log on to our app, and they're immediately connected with the doctor. 24 hours a day, 365 days a year. I think it's the price of that. It's just invaluable. You can't put a price on that.
Yeah, especially when your kids are away. And speak of Josephine today, yes, I had spoken with her, a very sweet woman, and she was just ecstatic about the product. And she mentioned actually 2 sons that she was going to be enrolling in addition to herself. I happen to have 2 children in college, and it is invaluable. Recently, I had gone to a dermatologist physically for my annual. I always go physically once a year because I've got some things that I always make sure I got to get taken care of. And I was sharing our company with the dermatologist, and she went absolutely ballistic. Couldn't believe it. Said it's about time somebody can deliver a product like this. And when she asked me if I had literature in my card, so I had to go out to the car after she treated me. And when I came back in, there was literally a crowd of 7 people. It was her, the other doctor, 4 nurses, and the bookkeeper. And when I walked through the door, I felt like a celebrity. I was like, oh, hi, guys. They're like, tell us about, what do you have? And I got this story, and I got that story. And the bookkeeper especially, she had signed up right after that visit because she said to me, I have a son up in Gainesville, Florida, who's attending college, and it cost me $140 last week for an urgent care visit. So he just got a Z-Pack, and it was $140 plus the medication. So it's really invaluable, especially when we have young children away at schools and things of that nature.
Okay, next question. How do you deal with infants? We ran into a situation this weekend with my son and his daughter. They had a stuffy nose, and Joe did a great job of helping me get them on the platform. But let's address infants, because obviously, someone says, well, how do you set up an email or the name in the email for an infant? How does that work for a mom that has a newborn or a young child that's under, say, 6 years old, what's the steps for that for those moms out there that may be considering this that have young kids?
I can do that one if you want.
Yeah, right.
So when you're adding a dependent, you can use, because I have three small kids. I got a 4-year-old, 5-year-olds. They all had birthdays this last month. 4-year-old, 5-year-old, 7-year-old, wow. And they all have their own account, but they all need an email address. So I just used my email address on their account, and then when I go ahead and I go to the, well, I can't do it here right on my phone right this second, but because I'm in the sample account. But then when I can choose who's going to be receiving the services, there's an option that pops up if it's going to be me or one of the dependents. And I have access to everybody who's a minor. As soon as somebody becomes 18 years old, they're an adult, and I only have access to their record if they authorize the primary to have access to that. So, but just to set it up, you can go in and you put in the birthdays. This system automatically knows how old your child is, if they need to go to a pediatrician or to a family physician, and you can just use your contact information for that minor child.
Okay, great. And then the last question, one other parent says, okay, if my child is sick and she needs her temperature taken, is it something I can do right there for the doctor to say, hey, could you check her temperature, hold the thermometer, can you walk through that since you have some experience with that?
Sure. So what happens is the doctor will ask you, do you know what your child's temperature is? Did you take their temperature? They may ask you to do it in front of them, and they'll ask you to do it twice just to confirm that some of this, the thermometers are tricky. But he'll say, here, do it. Go ahead, show it to me. Let me see it. You hold it up so he can see it. You say, okay, great. Thank you very much. And here's what you need to do. And they'll record that in the system as well. And that also can get sent to the PCP.
Okay, great. And then the last question is, are these doctors licensed, certified? Are they nurses, aides, physician assistants?
These are actual licensed medical physicians in the state that they're providing service. So as an example, when we were going through Scott Hackney, he's in multiple states because he's licensed in those multiple states. You may have a doctor, if you're in Florida and that doctor's physically located in Florida, they show their bio, you can go to the Department of Health and pull up that doctor's information and research that doctor and verify that they are an actual licensed medical doctor in that state.
Okay, great. And then the next question was, how long does it take, if I sign up, how long does it take before I can get access to schedule an appointment with a doctor, either by video or by phone?
Short answer is a couple days. So we work very closely with the telemedicine, and just in order to make sure that it gets from our system to their system, we'd say basically it takes a couple of days for that to happen.
Okay, great.
And Coach, let me add, when you're speaking of the physicians, our average physician has 15 years experience in healthcare.
Okay.
So it's not like, oh, we just got, John Smith doctor, he just got, just finished his college. No, these are all doctors with great experience, and I think people find comfort in that.
And in our analytics of last month, the average wait time was 6 minutes and change to be connected with a physician. So some it's 12 seconds, like Steve Utley was able to demonstrate. Others it might be a little bit longer depending on what's going on, flu season, all that stuff. But the average wait time. That was the average wait time.
Wow.
Yeah, huge.
And then this is the last one. I'll take this last comment here. What type of conditions or symptoms are the doctors able to treat? Because I think my friend of mine, Jason, asked about surgeries. Someone followed up and said, okay, we know it's not a surgery because we're not there yet, but what's the spectrum of what these doctors can cut, what they can treat without actually physically being there?
Yeah, you know what? I'm learning of new situations and scenarios every day. And I believe we'd shared in the past a couple of weeks ago. The most recent story for me personally was when my mother used it. Now, she wasn't diagnosed with gout, but the doctor recognized that she had a flare-up of gout. Because a lot of people, you know your own bodies. And you know if, you know what, I have this happening or I have that happening, you're aware of it. And if the physician feels comfortable doing it and they feel that it's necessary and appropriate, they will say, you know what, go ahead and here, I'm going to give you a prescription for X or Y. One of the most unique scenarios that I've seen a diagnosis and a prescription be given for was a pinched nerve in a lower back. And I was going, wow, how were they able to do that through the lens of a camera? And, you know, because of range of motion, if I could see you walking or not walking, range of motion and it happened. You know, I wasn't there during the consultation, but it came back to us. We, you know, came down down the line and we heard this and we're going, wow, that's great. That's amazing. Shingles, you know, somebody diagnosed with shingles and receiving a prescription for it. There's so many different unique things that we're you know, hearing about all the time. Steve Utley, if you want, talk about how like high blood pressure. You know, can I get a prescription if I have high blood pressure through this?
That is, yes, you can.
Yeah.
In fact, when we got our report, our usage reports, that was one of the common diagnoses that people were receiving via telemedicine was hypertension, which is high blood pressure, and there was a prescription issued in each of those instances that people called and was diagnosed with high blood pressure.
Wow. And someone said, are doctors able to treat like pink eye or, you know, those type of, you know, infectious type, you know, I don't know, that mono, but are they in that? Can they, what?
Pink eye, earaches, I've seen. I don't know about mono. I haven't heard that yet. But you know what I say? And the gentleman that told his wife, hey, with the pinched nerve, call them up and see what they say. If they say they can't do it, they can't do it. But there's every week we're hearing new stories, and I'm going, I didn't think of that. I didn't think of that. It's amazing how much is able to be done, and being able to speak to a physician, whereas instead of sitting in a waiting room and then going to talking to a nurse and then going and getting into the exam room, and a physician walks in staring at a clipboard, makes a couple of statements, and then exits, you're actually able to speak with the physician under this scenario, under this circumstances. And it means a lot to the patient, and it means a lot to the doctor because there's that open dialogue that goes back and forth. And if you're able to express something that's a need, and the doctor is there listening and deems it, you know, necessary and appropriate, they're able to go back and forth. There was a story this weekend where one of our nurses from our other agency that we have that's in 26, 27 states, she was going, oh my goodness, I used this, and the doctor actually gave me sent me an email, did not give me a prescription. With me, she's an RN. She goes, I agree with that diagnosis, but I was able to follow up with him 24 hours later and say, hey, there's new symptoms at this point. And the doctor was able to respond via email that he had opened that up and was able to give her a prescription at that point with the update of the new symptoms. So there's a lot going on. There's a lot of pieces that are involved with this, and it's just more and more we're seeing how this is able to be applied in so many different situations and scenarios.
Okay, you guys, Jim, you guys see the question Denise asked, what about arthritis as far as?
Yes, the answer is yes. In fact, On our website, we list about 50 common ailments that can be treated. But in reality, I was just looking through the list from our utilization report. It would probably take me 20 minutes to read what's been diagnosed. Arthritis is on that list, as a matter of fact. Just about anything you can think of is on this list. Surprisingly, what's been diagnosed and what prescriptions have been issued for.
So basically what you guys are saying, even though what you guys have is probably some of the most common things that are being treated, you guys are basically saying there are other scenarios that are popping up that have been treated even though it hasn't been on the list. I guess it really basically depends on if the doctor is able to properly diagnose the situation based on their experience. Am I right in saying that?
Absolutely right.
Yeah. It's their license.
When you see
on the line, they need to be accurate, and if they're not able to be accurate, they're not going to risk their license. So if a doctor is able to give a prescription and a diagnosis and a prognosis based on their license, that's what they do.
Okay, great. You was going to say something, Steve?
Well, what I was going to say, if you think about it, when you actually do a face-to-face visit with a doctor, you're not feeling when you do a face-to-face, other than it takes you, the whole experience probably is going to take you 24 hours and at least about 4 hours of time to get to the doctor, wait for the doctor, see the doctor, get a prescription, go get a prescription, and go home. All of that being said, when you actually see a doctor face-to-face, more than anything else, the doctor just asks you elimination questions. When did it start? What are your symptoms? How do you feel now? And then they start eliminating. That's face-to-face. It's no different in this process whatsoever. Over a telemedicine call, the doctor's going to go through a list of questions with you. Actually, a more comprehensive list of questions with you because they don't see you. And as in that CBS special that they did, the doctors feel like they develop a much better rapport with their patients because they're looking at each other at all times. When you go to a doctor, at least my experience has been, generally speaking, I'm talking to their back because they're typing on a computer or taking notes at a desk. I'm not looking at the doctor face-to-face, nor is the doctor seeing me face-to-face.
And they're being interrupted quite often.
Quite often interrupted. So.
Okay, the other question, I know that I was trying to close it, but there are more questions coming. Someone said, what about women that are pregnant? If they are feeling sick, but nothing, how can I say it? Let me see. Nothing emergency, but just not feeling well. Could they use this service if, depending on what trimester, if they're in the first, second, or third, could this service be of value to someone that's expecting?
Yeah, in fact, there's a couple of points that we didn't touch on. That let's say that you've gone and gotten some, you've seen your regular doctor and you've gotten just X-rays or sonograms or anything. You could upload all of that to your profile. So when you check in and you talk to a specialist, they can see what you've done in the past because you've uploaded and gave them access to that information.
Right.
Every one of our apps includes a personal electronic health record. You can put as much information in there as you want or none at all. Doesn't make any difference. But imagine a visit that starts at your kitchen table in Iowa, and you end up talking to a specialist in New York because that specialist is more qualified to give you the diagnosis based on your symptoms.
Right. Wow.
Invaluable, Coach.
Invaluable.
Yeah, it is. And I think most people are starting to get it because someone said, if I have a PPO and, I'm kind of stuck with the choices that are available, but if I'm on this plan, does this give me another avenue to be able to see someone else for non-emergency type issues? Because I think that's what most people are thinking. Do I have to give up my insurance plan that I have to be able to take advantage of this, or it's in conflict with what they generally have? So if someone has a PPO or HMO where basically they're completely different as far as your choices, but for someone that probably won't meet the deductible, what's the benefit? Can you guys touch on the deductible part of it? Because I think from what I'm reading, most people are thinking, man, my deductible is like $2,000 or $2,500. Do I have to use my deductible with my normal plan, or can I just use this and kind of stay under the radar, except for if there's a major emergency situation, then you have to go and use your insurance. And I think that's where the disconnect for some people. Can you kind of draw a comparison?
It's 8:30.
Non-emergency versus emergency when I need to use my actual insurance.
Can I give an illustration? You know, you love my illustrations, Coach.
Yeah, I do.
If you're in South Florida or any urban area recently, have you noticed all of the urgent care centers on every corner? Maybe even an urgent care center next to a hospital.
Got two outside.
Exactly. They're everywhere. They're just everywhere. Urgent care centers do not accept insurance. You walk in and you pay your fee. Let's just say it's $125. Usually it's more. You walk in and they say, how are you doing? Great. It's $125. And of course they ask you, are you going to ask me what's wrong with me? After you pay me, I will. So you give them $125 and you see a physician, get a diagnosis, maybe a prescription. That is essentially the same thing we are doing. You're prepaying for healthcare, but in our case, it's only $35. The same as if you walk into an urgent care. That does not affect your insurance. It doesn't affect your Medicare, your Medicaid. Any insurance plan that you have will not be affected because it is a transaction that occurs outside of your insurance. It's an amazing product. If you give me a choice to go to an urgent care, which is a long trip and expensive, or telemedicine, I'm going to choose telemedicine. And I'm going to get the same outcome for a lot less money.
Right. Okay, great. This is good questions. There's a lot of good questions coming in. The next question was, what if someone has pre-existing conditions because most people can't get coverage or their premiums are really high because they have pre-existing conditions? And then, unfortunately, guys, I have to tell you, when most folks are trying to get life insurance or some kind of insurance, they're actually having their credit being run also as a determining factor as to what kind of coverage they can receive. And that's part of my platform here is the education as far as cleaning up their credit. But let's just say for the sake of someone that has pre-existing conditions, they're out of work, but they have health conditions, they have not, they can't afford to spend $125 to go to a urgent care. What do you say to that person that's kind of falling on some hard times, they're in a hardship situation, for them to at least get somewhat healthy and get treated so they can get back out there and, get healthy enough to get a job?
We have a new website that's going to be made available within the next couple of weeks. It's going to give a better member experience. And some of the elements of the website you just touched on. One of those is that one of the things we talk about in our new website, that the foundation of happiness is good health. If you're not healthy, you're just not happy. At least I'm not. When I don't feel well, I'm not happy. This product allows anyone, regardless of their condition, regardless of their financial status, regardless of anything, there are no qualifications whatsoever. The qualifications are this: a name, an email address, because we need to be able to communicate with you. We need to know your gender, if you're a boy or a girl, and we need to know your date of birth. And the reason we need to know those things only is so we can make sure that we have the right person. There's very few people that are going to be named Willie Snead III with that email address and that date of birth. So that's how we identify who the patient is. We ask no other qualification questions whatsoever. It does not matter whatsoever. Anyone and everyone is welcome to come into the program.
Great. And what I'm going to do in closing, guys, I'm going to give you guys, a minute and a half each to kind of give some last thoughts, some last suggestions for folks that I'll post a link in the comment box for those that do want to look at the website and read more. But what would you guys say would be the most valuable thing about this platform to an individual out there watching? What's the most important thing that you would like to leave with them in terms of your company and the work and the commitment and the passion that you put into it, obviously to help those out there that are less fortunate than some of the others that can pay a couple $100, no problem. and go see a doctor as many times as they want. So what do you kind of close out what you would like to say in closing with those individuals?
So I'll start that off, Coach. So to me, especially that I'm married and have 3 children, the most valuable thing that I have found, and I wish I had this product 15, 20 years ago when my 21-year-old was a very small child, 24-hour-a-day access to healthcare. There's nothing better than that. I can tell you so many stories of when my children were little, and there it was, Friday night, 7 o'clock, here comes the fever, 102. And back then, there was not urgent cares on every corner. I didn't even have that option. The option was, holy cow, hope that this kid's fever stays okay until Monday morning, where then I got a call, get an appointment for 4 o'clock in the afternoon, and wait 2.5 hours. Those days are over. 24-hour access to board-certified licensed doctors that will give you the time and come to a good solution for you to feel better. Invaluable to me, Coach.
Hey, Coach, I think you made the point about those people that can afford to spend $200 to go to a doctor and those that may not be able to afford it. You made the point. Even if you can afford it, why would you want to do that? It's much more convenient to use our product, to use telemedicine. And I told a story in one of our other meetings last week, Coach, and I'll tell it again, then I'll have to stop talking. I always do when I tell this story. My mother passed away a few years ago, and she went to bed telling us that she felt like she was coming down with the flu. And I remember my father asking her if she wanted to go to the hospital. That was the only option at night. You want to go to the hospital? She goes, no, I'm just getting the flu, and I think I'm just going to go to bed and sleep it off. Well, she never woke up. So if we had, that's a particular memorable experience for me, because if we had had something like this back in the day, I would have insisted, of course, that my mother used the telemedicine product, and she could have been diagnosed and possibly saved her life. There are 4 primary elements to this that I love: family medicine, specialties, children away at college, and telemedicine for senior citizens. If you're removed from your parents, what a great option for them to have 24-hour access, even if they're on Medicare, even if they're on Medicaid. What difference does it make? For $35 a month, you put them on your plan, and now you know that your mother, your father, that is 1,000 miles away, has access to health care.
Yeah.
All right.
And one of the things that I like is when I grew up, I was raised by my grandparents, and there were months when it was food or medicine. And the months where we had to have medicine, or they had to have the medicine, it was, we're eating potato salad every day. And I'd go, Grandma, I'm hungry. And she'd like, eat potato salad. I go, I don't want potato salad. She's like, well, then you ain't hungry. You know? and here's the point to this is, it's no longer, it doesn't matter who you are, where you are, what you do, if it's 2 a.m. or 2 p.m. If you or your family member needs to see a doctor, you have access to a doctor. It's no longer sorry, you don't make enough money. Sorry, you make too much money. Sorry, you don't qualify. If you have $35, if you're the person that sells the flowers on the corner by my office, congratulations. You qualify to have complete access to licensed medical physicians in your area. It's that simple. If you have an address in the United States of America and you have $35, you can have health care for your entire household, medical, behavioral, and dermatology, and access to affordable prescriptions. And that's it.
Wow. Thanks, guys. I really, really appreciate it. And like I said, I think it's just one of those things where, there are a lot of people out there that I've come across that have called me ever since I started talking with Steve and Joey last Monday. They just had tons and tons of questions. And I think for most people, it's the fear that am I really going to get covered? Am I really going to be able to get the help? And and I tell people all the time, you can't squeeze $35 and hold on to it thinking that there is something bigger out there. It is what it is. Take advantage of it. You know, I think Steve, Joe, and Jim, you guys done a great job, gave some great illustrations for folks out there. It's better to have something than to have nothing at all. And I think we've all shared our testimony that if we had this available, I would have gave $100 a month to be able to get this coverage to save a life, because I think it's much more expensive to bury somebody than to keep them alive. And I think what you guys have done, you have created a huge bridge for a huge gap that's sitting there within our economy and, you know, just in communities all over. You know, I talk to guys that tell me, hey, my granny doesn't have any insurance. You know, she's old. You know, it's like, it's a sad story, but it's no longer being sad because now there's an option available to you. You know, we're not talking about, you know, I don't have all the money, but you know what? If it meant saving a loved one, I pay $100 a month if I can get this, because I think you can't put a price on your health and on the health of loved ones, especially when they don't have it. And I think we all can share, and a lot of you that are listening, we can all think back and look at someone that we've lost, and it could have been something as simple as getting that person treated. And I just think you cannot put a price on that. And I think I think we have to continue to push the message out there that there's help out there. And I can tell you guys, and this is the truth, a lot of people just don't know how to accept help. Even at $35 or $50, you know, the help is there. You have to take advantage of it. That's what it's there for. And I appreciate you guys for bringing this to the marketplace for people that say, you know what, I can't go to the doctor today, you know, because I just don't have it. So I'm going to go and look online, Google something, you know, how to cure this and that. How much, if we look at what we're spending a day, I don't have a calculator, but if you divide $35, it's less than $1 a day. I mean, I look at it in the simplest terms, guys. If I got 4 quarters and I got a pocket full of change, you know, we all have it around the house, either in your app, in your car, in the side. If you put all that together, and this is what I told someone today, they said, well, why is it so little? I said, because a lot of work and a lot of effort went into making this affordable. It's not waiting for the other shoe to drop. No, both shoes have fallen. This company is planted squarely and, you know, ready to service people that say, hey, I need some help here. I don't have $100. I don't have $75, but I do have 35. And I told him, and I simplified this guys in the simplest terms. This guy has 5 people in his family. And these are adults, not talking about the kid. I'm like, would it kill you all to invest $7 a month from each one of you?
Simple math, Coach.
Simple math. You have $7 you can give to keep your family, to give them another option, you know. And the other guy, he has 10 people. He said, well, I got 10 folks. Well, can you guys pitch in $3.50 a month, $3.50 a month to cover those folks? You know, and that's kind of how I'm an educator, and I want to simplify things in the simplest terms, because I think, and you guys have been in business a long time, it always comes down, money becomes a central focus. Here, what you guys have done was made health and wellness the central focus. And you guys have dummied down this process so much to where if you got 10 people, a household of 10 people, who can't come up with $3.50 over a 30-day period? I mean, really? And to me, that's the simplest terms you can put it. But again, like I said, if it was $100 and there was 5 of us, like, okay, we need to put $20 in a month so we can cover ourselves until somebody in the house can get a job that has insurance that can put us under that plan. It's all about strategic planning, guys. Maybe it's the coach in me, but I always look for the common denominator to minimize the risk. And there's very, very little risk financially with this, but the rewards, the comfort that you have risk-wise with your health is off the chart.
Yeah, the value is unmatched, Coach. It's unmatched. it's a no-brainer.
Yeah. So, but I appreciate you guys, and like I said, I still have people texting, and we'll get back with them. But I definitely would love to have you guys come back because I'm getting more and more questions. But I think that's a good thing that people are still asking, and I want them to have a comfort level listening to you guys because you guys built a great company. And I think the most important thing in closing was most people thought that Health Alliance Network, this was it. And I think Steve did a great job in explaining, no, this is one aspect of what we do to service people. We do have a healthcare company. We are a healthcare, platform. This is just another way for people that can't walk in the door and throw $150 cash down and get treated for something as simple as a non-emergency issue. And that's the thing that I appreciate you guys for. And I tell you, it angered me when I'm thinking, if I'm giving somebody $150 just to see me, I'm in and out, and then come to find out, I could have spent $35 and walked in the same door and got the same service. Man, I'm telling you, I'm not going to get on the health, but you guys know what I'm talking about. Man, that is like, for someone trying to save money, they should be running through the door, taking advantage of this. There's 2 urgent cares right down the street here on Military. And if we ever needed help, I don't have to do that. I can go to this bad boy right here.
That's right.
Get the help that I. But guys, I appreciate you, man. I really do appreciate you guys. And we're going to have you guys back on. I'll touch bases with you guys, take some more questions, and those questions that I get will be the platform for the show so we can give everybody a comfort level. Can you guys just touch on how many people that was the last question, how many people are actively or involved or as patients or lives on the platform versus how many people we have in this country? And we'll close with that.
So I think I might have touched on that with you another time too, Coach. So right now there are 1.2 million lives on our platform, which sounds like a high number, but it's a tiny number. There's roughly 328 million Americans, and there's probably another 25 million undocumented people in this country that can also benefit from using our program because we do not require the social security numbers or driver's licenses, things of that nature. So we are, as Jimmy referenced earlier, we are here to help everyone. Whether you're a flower salesperson on the corner or whatever, it doesn't matter. You can come on our platform and have the full access to doctors. So 1.2 million people are in front of the train. The rest of the people will be boarding the train because it's just that great. And if you think about it, Coach, logically, every single one of us should have access to healthcare through our telemedicine platform because it just makes complete sense.
Well, Joey, going off of what you say, there's actually companies that exist out there for a VIP concierge service where people pay $5,000 just to go to the head of the line or to pay $5,000 and say, you know what, doc, when I call, answer the phone and pick up. That exists. And we're not saying, we're saying, listen, we're giving this VIP service, which is you can access a doctor from the comfort and safety of your own home for your entire household for $35 a month.
Jimmy, yesterday was Father's Day. I spent it with my dad. My dad's 80 years old, great man. And we were sitting talking about company and everything. And he says, I just received a letter from my cardiologist asking me if I want to become part of his VIP patient thing, $1,800 a year. He can join $1,800. My father was flipping out. He goes, this guy wants to pay $1,800 a year so I could get him faster than the way I'm already supposed to be getting him.
Yep. so Coach, $4 and I'll do my job more efficiently.
Right.
I point out that our company is not subsidized by any government funds. It's a private company, which means everyone qualifies. The government doesn't get to tell us who we can and cannot pay.
Good point. Good point. Good point. Good point, guys. I thank you guys. I appreciate it. I got to get back. I got a ton of work to do, still staring at me. My phone is buzzing with text messages. But we're going to pick this up again. We'll talk about the format for next Monday.
Hey, Coach.
And I'll take all the questions, and we'll just keep chipping away and just really keep pushing this agenda to get people on the train, to get them the coverage that they need. Guys, I appreciate you guys joining tonight. I want to thank all my viewers for watching tonight, and we will be back on Wednesday night talking about credit and pigskin. We're less than 100 days left before the football season starts, and I'm starting to get all my fantasy players talking about football. So we're going to be talking about that, and we're also going to be talking about credit. But guys, I thank you guys for joining tonight. Please share this video after you watch it, and let's make the world a healthier place. I'll see you guys later. Take care. Peace.
Thanks, Coach. Thank you.